Sir, please continue.
Okay. Thank you very much, madam. Good evening, dear friends. Today, we're just going to see some of the points about the cancer in animals. Now, like in human being, cancer in animals also reduces the productivity. When we are rearing the animals for the production, it is our duty to have a healthy animals and free from any disease. Now, cancer is one of the disease which is very dangerous. Some type of cancers are curable. Usual amount of is affected by several factors like breed, season of calving, which type of breed it is. I am audible, madam? Hello, 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 hello. Can anyone respond? Hello, 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 madam. Hello, hello, madam. Hello, any delegates? I am audible. Hello, delegates. Hello, madam. Hello, hello, madam. Hello, hello, hello.
Hello? Sir,
Yes,
please start your presentation again.
yes. Sorry, madam.
So no issue at all.
So share, then hide.
You enter a screen? Yes,
Yeah,
sir. Okay, sir. So go
and
on PowerPoint.
F5.
Yes, sir. So PowerPoint पे चाहिए. Sir, click on the entire screen. Click on present now. Then click on your entire screen. Hello, sir. Hello. Hello. Hello.
Yes, madam.
Lokhande sir, please unmute yourself. Okay, sir.
Yes.
So on the bottom of the screen there is a fifth icon. Click
PowerPoint, entire
present
screen.
now.
Yes.
Click on entire screen. Then click comes the window. So click on that. Then click on share button.
Hmm. And then hide.
So then not hide.
Hmm.
So just start. Let us. So go to PowerPoint presentation.
Huh.
Okay, sir. Okay, so click F5.
Okay.
Okay, so click on hide button. Okay, so perfectly fine. So go on the slide on which you
Yes.
stop.
Now it is
Okay, sir.
visible.
Yes, sir, it is visible.
Okay.
You are on
Okay.
second slide,
Yeah.
introduction.
I'm very sorry, delegates. I'm very sorry. I was
No issue,
disrupted.
sir.
Yeah. So as I was talking about the milk production, it was affected by several factors like the breed. So different breeds give different amount of milk. Then season of calving, what time or in which season they are calving. Then geographic reason and management factor is more important, like which nutrition you are giving, what type of nutrition and all that, and how frequently you are milking all that. So you all know all these things. So these produce or these affect the milking. Now there are some diseases like mastitis, ketosis, milk fever, and even the disturbance in the digestive system can also cause decrease in the milk production. Specifically, if we talk about the milk production. Okay. The occurrence of subclinical mastitis is one of the disease. Subclinical mastitis is causes 10% decrease in production. So that much loss occurs in the mastitis. Similarly, the cancer in the animal also affect the production, the milk production, the meat production, and other byproduct productions. Okay. So cancer is nothing but the tumor which is caused in human being and in animal by purposeless multiplication of a living cells. Normal cells multiply purposelessly. Okay, they produce tumor. So if it is a new growth, then we term it as neoplasm. Or if it is a new tissue, we call it as neoplasia. Now, these tumors are more common in carnivorous animals like dogs and all that, but it is also present in herbivorous animals, and it is also common in old ages. So, what is the etiology in general of the tumor is not well established. But some people are saying it is occurring because of some of the viruses. The example is oral papillomas. In cattle, you will find the small papillary growth occurs in the oral cavity, and then these enable the animal to take the food, and then animal become emaciated, and then the production loses. Also, in some of the animals, there is a venereal granuloma occurs. So we'll see what is the classification for this cancer. Now, broadly, it is classified clinically as benign tumor or simple tumor. It is called as benign tumor or simple tumor. The second type is the malignant tumor. Malignant tumor. Now, we can also classify the tumor on the basis of histological structure by examining under the microscope histologically. So, they are classified as fibroma, osteoma, sarcoma, and all that things. Based on embryonic layer, as we know that the embryonic membrane is having different layer, and based on this embryonic layer, we also classified as epiblast, metablast, or hypoblast, and all that. So these are the different varieties of tumor. Okay, connective tissue tumors are fibroma. Example is nasal polyp growth in horses. It is very common. Nasal polyp growth. It is nothing but a connective tissue tumor, which is a fibroma. Chondroma. It is a tumor of cartilaginous tissue. So, when the tumor occurs of the cartilaginous tissue, it is called as chondroma. Similar way, we classified as osteoma at a dental alveoli, sinus, or mandible. So, bone is affected. Osteoma. Odontoma. It is a tumor of tooth, which involves enamel, cementum, and dentin, the part of the tooth. Odontoma. Then we also get epulis, which is nothing but the tumor of alveolar border, means bone and periosteum of the alveolar border. When it shows the tumor, it is epulis. Similar way, the tumor of muscles is called as myoma. The example is rhabdomyoma. Then myxoma, it is a resemble of connective tissue tumor. Lipoma. Lipoma is nothing but the tumor of fat cells. Neuroma. It is the tumor of nerve cell or nerve fiber. Glioma is nothing but neurological tissues tumor. Glioma. Similar way, angioma, which is related with the blood vessels. So lymphatic and blood vessels tumor is called as angioma. Sarcoma is nothing but the malignant tumor. So above all are the benign tumor, whereas sarcoma, when it comes terminology sarcoma, then it is called as malignant tumor. So example is osteosarcoma or chondrosarcoma, exactly like that. Fibroma is more common in animals. Okay. Melanoma, compound of melanin pigmented cells. It is common in gray horses, red pigs, and it is a malignant type of tumor. Similar way, osteosarcoma, it is a common tumor, malignant tumor of the bone extremities, specifically in more common in dogs. So now you can see here the pictures. This is the cutaneous fibroma in case of deer. Okay, so all this is the pictures is just to show you how it looks like. Okay, so in this picture you will find some of the small animals are also included. The aim is to know how the tumor look like. So cutaneous fibroma, okay, odontoma, it looks like this. Then epulis, see here there is a swelling, all the gum is swollen. So it is nothing but the epulis. Fat cell tumor, lipoma. This is the picture of dog I have just taken for the visualization purpose. So a big fat cell is produced. Similar way, neuroma, a nerve cell and fiber tumor. This is the ultrasound image of neuroma. You can see here, this is the nerve and there is an extra growth of the nerve. So neuroma. Similarly, glioma, localized glioma. CT scan is showing the glioma, localized glioma. Hemangioma, hemangiosarcoma of the liver. Hemangio means bleeding, blood. Hemangiosarcoma of the liver. Here you can see very clearly. Then this is the fibrosarcoma in case of horses, and mule it is common. And osteosarcoma, the bone cancers. Here you can see the osteolytic changes occur. The cancer cell has eaten up the bone. Okay, and therefore the density of the bone has reduced. Here there is an extra bone formation is occur. The second type is the epithelial tumors. In that there is a papillomas. The example is wart or oral papillomas or vaginal papillomas. Here you can see all these warts are there. Okay, so these are epithelial cell tumor warts. Then adenoma, which is a glandular adenoma. Okay, the adenoma of salivary gland. Here you can see the salivary gland. Okay, so adenoma of upper eyelid, right? Upper eyelid, the adenoma. Then you will also get carcinoma, carcinoma of the horn. This is the squamous cell carcinoma in case of cattle, horn. This is the basal cell carcinoma. Here you can see the basal cell carcinoma. Okay. Then the third type is endothelial tumors. So these endothelial tumors, in these there is a mesothelioma, mesothelial tissues tumor, perithelioma, which is nothing but the tunica adventitia of blood vessel, inner wall. Then samoma, which is nothing but the brain cell tumor. Then cholesteatoma means nothing but the tumor of crystalline structures. Okay, so these are all endothelial cells. Then you will get lymphoid cell tumors. In that you will get lymphoma or lymphosarcoma. So this is the lymphosarcoma, lymphoid cell tissues. Okay, so lymphosarcoma. This is the lymphosarcoma of the leukemia complex, right? So lymphosarcoma. Then you will also get the teratomas, which is nothing but the disorderly arranged tissue. They are also classified in the form of tumors. No doubt they are cysts, but they are also classified as a tumor. So it is a faulty embryonic differentiation or organization. You will get dermoid cyst. Okay, dermoid cyst. I told you it is also called as cyst. So it is the cutaneous tissue tumor. Then dentigious cyst. It is nothing but a cyst which is having the tooth. Okay, so in abnormal area you will find a cyst containing the tooth. So that is the dentigious cyst. So these all different type of tumors you can diagnose by some of the tumors by their look. Okay, specifically the papillomas. Okay, very typical growth is there. So, and warts you can see by grossly examination, or otherwise for diagnosis you have to go for histopathology. Okay, right. So these in general, as I told you, there are two types of basic classification. One is benign tumor, another is malignant tumor. So benign tumor, they slow growth is slow, whereas in malignant they grow fast. Benign tumor are more localized. Malignant tumor, you will find metastasis. You will find multiple tumors away from the area of the basic tumor site. Okay, so secondary tumors are there because of the metastasis. Generally, benign tumor do not adhere with the skin. Okay, But malignant tumors are most of the time, it's not a hard and fast rule, but most of the tumors, malignant tumors, they adhere with the skin. These benign tumor do not ulcerate. You will not find ulceration on the tumor, whereas the skin shows ulceration, ulcer formation if it is malignant type of tumor. They are not a relapse after surgery. If you have done surgery and if you have removed all an entire tumor with some healthy tissue from surrounding area, then it will not reoccur. But malignant, as they metastasize, you will find they may reoccur, okay, even after surgery. And benign tumor, the cells resembles like an original cells, and in malignant tumors, they sometimes do not resembles like the original cells. Okay, so prognosis, as far as the benign tumor is concerned, they are non-harmful. Only because of the size, they give mechanical pressure on the surrounding tissue. Suppose a very big tumor is there on the limb, so it will hamper the locomotion. Animal cannot able to walk properly. If it is near the udder, then it will hamper in the milking. Okay, so it interferes with the function. Okay, so that is there. Whereas malignant, some are incurable, some are curable. In human being, the science is so developed that they are curable. Okay, so a typical tumors we will see in the large animal, and that is, first is the eye cancer. Eye cancer is very common. Squamous cell or ocular squamous cell carcinoma. These are cancer eye. It is the most common neoplasm of the cattle. Occurs in both the sexes. So it is very common. It is occur in both the sexes, but it is common in female. It results in significant economical loss due to shortening productive life. So tumor, definitely the tumor is there. So animal is not healthy, animal is not comfortable. The life will shorten. And when the animal life is shortened, the production from that animal also get reduced. Okay, and then there is a condemnation at the slaughter. You will find the slaughter at the slaughter, whatever the for the meat purpose, suppose some animals are useful, they deteriorate the quality of the meat. Okay, and therefore the production is lost. These squamous cell carcinoma or eye cancer occurs more frequently in Bos tertius animal. Okay, this species or breed of the animal, it is very common. Then indicus, Bos indicus rarely occur, but it is also rarely occur in other breeds. Ocule occurs in all age groups. So these type of tumors, it occurs in all age group, and the peak age of the incidence is 8 years of age. So more commonly occurs in the age group of 8 years in cattle. The actual incidence of this tumor, eye cancer, in animal is from 0.8% to 5% among the herds. Okay, so it is not very common. The cancerous or precancerous lesion are bilateral or multiple in the same eye. So you will find these cancerous tumor or precancerous lesion, they sometimes present in both the eyes or sometimes present in one eye and multiple growth. Okay. Now, etiology of this eye cancer is also not fully known, but study shows that it is a genetic predisposition. Because of the genetic, it occurs in some of the animals. It also occurs because of the radiation, specifically the sunlight radiation. So when we keep our animal under the sun for a longer time, it causes irritation, radiation, and lead to the eye cancer. Some reports are also there of occurrence because of the viruses, specifically the infectious bovine rhinotracheitis or bovine herpes viruses or papilloma. So these are the viruses which are also responsible for some of the eye cancers. These also occurs because of the irritation due to dust, irritation due to sand, irritation due to insect. Sometimes the insect, so many flies are there surrounding and is always irritating the eyes. Okay, so these are also one of the reason they studied and they found this reason. And also chemicals. So chemicals are irritant, causes irritation and unnecessarily multiplication of the cell because of the irritation. Then non-pigmented orbital skin. The skin which is non-pigmented surrounding the orbit, eyeball, is also a high risk factor. So the animal who are having non-pigmented skin surrounding the eyeball or orbit, they are also more prone to eye cancer. Now, the clinical signs. So how it will look like the eye cancer? The most common area of this type of tumor occurs in limbus. So one is the limbus, which is very common. Limbus is nothing but the junction of sclera. Sclera means white portion of our eyeball, and cornea. Cornea is the transparent portion of the eyeball. So the junction where the cornea and the sclera are meeting, that portion is called as limbus. So at that portion, the eye cancer are very common. It is also common on the third eyelid. The animal is having third eyelid, okay, which cleans, which acts like a wiper, okay, which cleans the eye, cornea. So there also it is very common, the eye cancer. And also on the upper and lower eyelid margin. So eyelids, all the three eyelids are the common site for eye cancer. Generally, there are 4 common stages in the development of this ocular tumor. Okay, so we'll not go in very detail, but you should know it, that they are called as flux, keratoma, papilloma, and carcinoma. So these are broadly classified, broadly. Okay, now out of these first 3 stages, plaques, keratoma, and papilloma, they are benign type of tumors. But carcinomas, they are malignant tumors, as I told you. Okay, so we'll just see the pictures are there, very beautiful picture. You can see these are the plaques appears as a small circular white elevation on the surface of eye. So this is a small elevation, white color circular present on the limbus. Okay, so these are plaques. Then keratoma, it is a hard raised growth on the eyelid. So on the eyelid you will find there is a swelling and it is coated with the secretions, ocular secretions and debris. Okay, so that they are called as keratoma. Similar way, the papilloma appears as a wart-like growth. So here you can see on the limbus there is a wart-like growth which is present. Okay, so this is nothing but the papilloma. And carcinoma, as I told you, is a malignant type. Carcinoma, they are appears as a nodular growth. So all this nodular growth, okay, cauliflower-like growth, okay, and they are commonly bloody type. So bleeding, always you will find there is a bleeding is coming out, irregular growth, ulcerated, ulcers occur. Okay, they are very fragile, and they shows or they give foul smelling. Okay, so typically you will able to diagnose that yes, this is not a simple tumor, but this is a carcinoma or malignant type of tumor. Okay, at any stage the tumor could effectively regress. So because of our body immunity, it is possible that these cells or tumors effectively regress. Okay, but more advanced the lesion is, the likely of this regression is less. Okay, so that's obvious. If it is remaining there for a longer period, then the chances of regression reduces. Benign tumors are more frequently regresses than the malignant tumors. So the chances of regression is more there in benign tumor than the malignant tumor, because malignant tumor they spread. So even though it regresses at the origin place, they can reoccur in another place, or also after sometimes they can again appear on the original place, okay, because they are metastatized. The malignant form or carcinoma will progressively grows. They will grow progressively, and if left untreated, then it will spread or invade it into entire orbit, including eyeball and large portion of the face. If suppose remain as it is, then these tumors spread not only eyeball, not only on the orbit, but also enter into the muscles and the skin of the face region. Okay, so it will spread. Invasion of eyeball will result into blindness. So if suppose it is invaded in the eyeball, then animal will become blind. The regional lymph node around the head and the neck, specifically the parotid lymph node and mandibulary lymph node. So these malignant tumors or cell, they metastasize in the nearby lymph node. The common site is parotid and submandibular lymph node in case of eye cancer. Okay, so these I have already shown you the different type. Okay, so diagnosis of ocular squamous cell carcinoma is usually made by typical clinical appearance. We can see from the distance only, as I told you in these pictures. So typical appearance will give you idea about the tumors. Confirmed rapidly by cytological examination. So we take a smear impression and we examine under the microscope. So cytological examination will confirm it rapidly. Pre-treatment diagnosis technique such as impression cytology are of great value and can aid in clinical decision making and follow-up management. So early diagnosis will give you sufficient ample amount of time to decide what line of treatment you should follow in such case, so that it will not progress or it will subside easily. Okay. Histopathological examination of the biopsy sample. We take a biopsy sample, a piece from the growth, and we do histopathology under the microscope for the confirmation of diagnosis. So now this picture, you can see here, there is a neoplastic tissue in the third eyelid. So third eyelid showing neoplastic tissue. This is the squamous cell carcinoma, okay, sample piece, right? And this is the histopathological examination of the slide, where all the cells and all that is are visible. So from that we can diagnose and we can take the decision for the treatment. The treatment is highly depends on the location of the tumor and the degree of invasion of this underlying tissue. So where it is, okay, because eyeball is very delicate structure, very delicate organ, you can say. So if it is on the eyelid, then it is very easy to remove. If it is on upper eyelid or if it is on lower eyelid or third eyelid, it is very easy to remove. But if it is on the limbus or if it is more towards the cornea, then it is little difficult, because when you are removing, there is a possibility of opacity of the cornea and animal may become blind. Okay, and also depend upon how much it has spread, how much it has invaded, okay, underlying tissues. These are the various options. Number one is surgical excision. So it is surgical. Most of the time people go for surgical excision, surgical removal. Excision of the lesion is most accepted method of treatment of squamous neoplasia on the ocular surface, specifically if it is present on the bulbar conjunctiva, okay, or corneolimbal or corneal tissue. So if it is present on the bulbar conjunctiva, means conjunctiva of the eyeball, okay, it's called as bulbar conjunctiva. Okay, palpebral conjunctiva means the conjunctiva of eyelid, right? So if it is present, then it is possible to remove very easily. Okay, so it is possible to remove even from the corneal tissues. Dissection, also you can do the dissection of all abnormal tissue within a wide surgical margin. So you can dissect it nicely, and also you have to dissect the surrounding tissue up to the 2 to 3 mm. The healthy tissue growth, okay, but it is also present on the surrounding tissue, okay, it is present on the surrounding tissue. So it is, you have to remove from the tissue from the surrounding tissue also you have to remove. Okay, so dissection, we are removing the cell along with the removal of the margin up to 2 to 3 mm, okay, along the periphery is effective. Then you can also do enucleation, okay, this is also generally recommended. Then prognosis is favorable if operation is performed in the early stage, and if it involves complete removal of the neoplasm tissue. So if it is not an old, if it is not invaded deeper structure, if it is a superficial, and if you succeed in remove the entire growth or tumor cell, then the prognosis is always good. Okay, prognosis is always good. Okay, prognosis is always favorable, right? If it is completely removed, then anesthesia, the retrobulbar and modified Peterson eye block work equally well in providing the anesthesia to the region. Okay, so we generally give technique, modified Peterson eye block, very commonly we are using these things. Okay, right. Then we can also go for cryotherapy. Cryotherapy, cryotherapy for ocular squamous cell carcinoma is relatively simple, rapid procedure. Okay, to treat, which causing what it causes? It causes tumor cell death by necrosis. So cryotherapy means therapy of the cold things. We use cold water or these the medicines which reduce the temperature. Okay, so with this the necrosis occurs at the base and the cells falls down. It provides analgesia, so it also provides analgesic painkiller for several months because of the sensory nerve injury. Then the procedure cause minimal side effects. So side effects are very less side effect when you are using cryotherapy. Okay, and you can also repeat the cryotherapy. It is effective because malignant cells are more sensitive. It is found that these cells, malignant cells, they are more sensitive to the cryotherapy, and that is why removal of the cells are very easy. Not recommended for tumor larger than 50 millimeters. So 5 centimeter, the tumor more than 5 centimeter, for that this is not recommended. For that the surgery is best. Okay. For those which is margins are ill defined, the margins are also not properly defined, for that also the cryotherapy is of no use. Massive tissue necrosis will loss of eyelid can seen if lesions are too large, and for this type of therapy. So there are side effects also, because when you are removing very big tumor, then there is a possibility that it cause necrosis of the surrounding tissue. Okay. Then we can also use radio frequency hyperthermia. Radio frequency hyperthermia. Okay. So hyperthermia are fairly effective and they are easily applied treatment to more, for this the ocular squamous cell carcinomas. Okay. In cattle, tumor cell is heated by localized electric current field. So localized electric current field is applied and the cell is heated. Okay. Topical anesthesia and adequate head restraining are necessary, because when you are burning, it is like a cautery. So when we are cauterying, it is causing hyperthermia, increasing in the temperature. So it should also cause injury to the surrounding tissue. And that is why proper topical anesthesia and proper head restraining is very important. Otherwise, you are spoiling the other normal structures also when you are doing this technique for these things. Okay, tumor larger than 15 millimeter or 5 centimeter in diameter, and those with a deep eyelid involvement or conjunctival penetration do not respond. So here also hyperthermia is also not good for the cells or the tumor which is bigger than 5 centimeter or the tumor which is deeply invaded. The tumor less than 25 millimeter is best. So 2.5 centimeter, 2.5 centimeter type of tumor is best to use hyperthermia. Then we can also use immunotherapy and chemotherapy. Several variations of immunotherapy have been used for the treatment of ocular squamous cell carcinomas, such as tumor-derived vaccines. We prepared vaccines from these tumor cells. We can also use non-specific immunogens, and we can also use cytokine therapy. So these are the immunotherapy or chemotherapy which also useful. Most of the time they are using in human being, but in animals also we are using, and it is giving good results. Then radiation therapy is also one of the good method. Generally, irradiation alone is not recommended. So radiation alone is not recommended. If the tumor is very big, then it will take more radiation to kill such a cell. So in such a condition, we remove maximum cell with the surgery, and the small part cells we irradiate, or we first irradiate the tumor so that it becomes smaller size, and then we can go for other type of therapy. Okay. So alone it is not recommended. It is usually as an adjunct treatment for diffuse or spreading lesion. Suppose it is a diffuse type of lesion, spreading where there is not possible to remove surgical, there it is useful, spreading type of lesion. Or you can also use for pre-treatment to shrink the lesion. So very big growth is not possible to remove, so you just give the radiation therapy so that the growth will shrink, and then it will become easy to remove, right? So like this. Now options for radiation therapy includes, these are the different radiations they are using: SR90, cobalt 60, gold 198, iridium 192, cesium 137, iodine 125, radon 222. So these are also used along with the gamma rays, which emits gamma rays and all that, used for the radiation therapy. Radiation therapy is one of the most effective therapy for deeply infiltrate cases. So if it is deeply invaded, in this case, the radiation therapy is good therapy, but it is costly and the availability is the limited. So everywhere it is not available, but wherever it is available, people are doing radiation therapy. So these are the some of the pictures where you can see these are the growths are there. Okay. The second is, I will finish it very fast. Second is horn cancer. So I cancer, similar way there is a horn cancer. Horn cancer is nothing but a carcinoma. It is commonly stratified squamous cell carcinoma. So horn cancer is a stratified squamous cell carcinoma, which is characterized by softening of the horn base. So initially there will be a softening of the horn base. Okay, the base of the horn becomes soft, followed by necrosis. So that the base will become necrosed, will start becoming necrosed. Okay, and then there will be the bending because it is become soft and necrosed. The horn will tilt towards the one side, bending of the horn, and finally break down. The horn get break down and it will fall down. And when the horn will fall down, you will find at the base there is a cauliflower like tissue. See here, there is all granulating type of tissues at the base of the horn, okay, which is having offensive odor. Okay, so like this, the cancerous hard tissue converts into spongy. So whatever the hard tissue, the bony tissue of the horn become now spongy, grayish white cauliflower like tumor, okay, and which is having rough or verrucous surfaces. So here you can see very nice picture. The horn is tilted and is bended, and here there is a broken down. It is also a malignant in nature, originate from squamous cell lining of core at the base of horn. So horn core, at that base, the squamous cells start irritating and multiplication. It affects 5 to 10 years age of the animal. It is unilateral. Most of the time it is unilateral. Okay, highest incidence occur in those breed which are having long horn and white coat, white color animal and long horn, like concretes or gir or even killar. So these breeds are more prone to the horn cancer. Again, the etiology is trauma. Most of the time mechanical trauma causes irritation. Then chronic irradiation at the base of horn, irritation, chronic irritation because of worms, because of the flies and all that. So constantly irritating at the base of horn, leading to this cancer. Solar radiation, animal is standing under the sun, non-shaded area. Now, solar energy will cause radiation and lead to this thing. Use of paints, chemicals. When we use paints on the horn to decorate the animal, these paints also causes irritation leading to horn cancer. There are some viruses which are also responsible for this type of cancer, and some study also suggests it is a genetic factor responsible for horn cancer. So clinical signs, you will find signs of pain manifested by keeping head tilted lower or inclined towards the affected area. So painful, it is very painful condition. And therefore to relieve the pain, animal will tilt the head towards the affected horn. Okay. Then animal is constantly shaking his head. So head is always shaking because of the irritation. Then striking with the limb. So always it will rub with the limb. Rubbing of the horn with the hard object, the manger or the pole which is present, the animal will rub his horn or base of the horn to relieve the pain and irritation. Then foul smelling discharge from the nostril. You will also notice there is a foul smelling discharge will come from the nostrils. Okay, and when you see closely, you will find the discharge is also coming from the base of the horn. Okay, base of the affected horn. In the advanced stages, if it is not taken care of properly, then the horn will start tilting, okay, towards the one side, and eventually separation at the base of horn, leading to cauliflower like exposed growth which bleeds easily and give off and on offensive odor. So the horn will fall down, the base will show you the cauliflower like growth which is bleeding type of nature, means if you touch or if you get rubbed, it will start bleeding, and there is an offensive odor will be there. So here these are the pictures. Here you can see initially there is a swelling at the base of the horn, then softening of the base of the horn, okay, tilting of the horn. You can see here the horn is tilted. This is normal horn, another horn is tilted, tilting of the horn. Okay, so here also again there is a tilting of the horn. then there is a breaking of the horn. So horn is fallen down, broken, and you will find the cauliflower like growth, which is easy to bleed, offensive odor. Okay, so this is all growth which is present at the base of the horn. Diagnosis can be made by history, because it is genetic predisposed. Also, physical examination and clinical signs. You have to examine, see the horn, the softness at the base of the horn, discharge, and clinical signs, rubbing, tilting, shaking, and all these signs will give you idea about which horn. Radiology, when you take the x-ray of the horn, definitely that you will find there is a bone is lytic, bone is eaten up by this cancer cell. So there is no bony portion present at the base of the horn. Okay, and post surgery you can also diagnose by histopathology. So when you have done the surgery, take the tissue and you can take histopathological examination and you can diagnose. Even you can diagnose histopathology by taking the biopsy, and diagnosis is possible in this way. Treatment generally very difficult, or sometimes it is impossible to give the treatment. Horn cancer, we perform surgical correction. In that we perform amputation of the horn. So most of the time in animals, whenever there is a cancer at the extremities, it is very easy or better to remove that part, okay, than remove the growth, because if it is a malignant, then it can reoccur, right? So if it is possible, you can remove that growth if it is not recurring or if it is a malignant. Otherwise, suppose it is on their hoof, then it is better to remove that entire hoof along with the growth. Okay, so like that is there. So amputation of the horn is the common treatment for horn cancer. You can also use autogenous vaccines derived from cancerous tissues of the amputated horn. Okay, so this is the surgical management. Will not go in very detail. Okay, so pictures are there. I have just given you the pictures. We have done the shaving, then the local anesthesia. Okay, then after doing the local anesthesia, we take the elliptical incision at the base of the horn. Okay, so elliptical incision, lifting of the skin flap, and then amputation. So with the saw we removed, okay, with the saw, so entire horn is removed, and then it is sutured. So this is, you can see here, this is the hollow portion, and then the flap is sutured. Okay, so like this it is, and then bandaging. So post-operative care, application of fly repellent surrounding the operated area. Fly should not sit. Antibiotic, painkiller, antihistamine you give for 5 to 7 days. Daily antiseptic dressing on the suture line. Tie animal away from the hard surface. Okay, otherwise the animal will rub, and suture is to be removed after 12 to 15 post-operative day. And advice to the animal is that animal should be kept away from tree to avoid scratching and self-mutilation of the surgical wound. Okay, so these are the references from where I have collected. Thank you very much. Thank you very much. If anybody is having some doubt or any question, I will try to give the answer.
Thank you, sir. Thank you, everyone. If you have any questions, please ask. So I think there are no questions. Thank you
Okay,
on
okay.
behalf of NETCL. Thank you on behalf of participants. Thanks.
Thank you very much, madam. Thank you.